Hello grade 10. Welcome to our online video lesson for today. I am Teacher Jenny, your teacher on MAPE subject. So before we start, let's have an opening prayer. Let us put ourselves in the holy presence of our Lord. Lord God, thank you so much for giving us another day to study and prepare for a good life in the future. We thank you for all the blessings you have bestowed upon us. Thank you for providing our needs and for giving us the chance to continue our study. Bless our teachers who teach and guide us, our parents who support and work for us. Bless our classmates and friends who care for us. Bless our country and all the people who continue fighting in times of pandemic. We are humbly asking for your guidance as we begin our online class today. Send us your Holy Spirit so we may understand and achieve the objectives of our lessons. Help us, Lord, to listen to our teachers so we may gain knowledge imparted to us. Give us energy and knowledge to participate in today's online class. Give us knowledge to answer all activities assigned to us. Fill our hearts with joy, our minds with learning, and peace of mind in studying. We ask all of this through Christ our Lord, who lives and reigns forever and ever. Amen. Start your day with a smile. Good morning, grade 10. Before we start, let us prepare your module. Get your pen and your answer sheet. So our lesson for today about Health 10, Water 4, Module number 2, Exploring and Deciding on an Appropriate Health Career Path. So let me read the learning objectives. At the end of this module, the students are expected to explore the various health career paths, select a particular health career pathway based on personal competence and interests, participates in a health career orientation program, and decides on appropriate health career path. Parts of the module. We have different parts of the module. Start with what I need to know, what I know, what's in, what's new, what is it, what's more, what I have learned, what I can do, assessment, and the last part is the additional activities. Those are the different parts of the module. Let's try to answer what I know activities. Test 1. Directions. In column A, read each sample careers and match it to column B, to which health career path it belongs. Write the letter of your chosen answer on your answer sheet. Test 2. Directions. Read each statement, then write the letter of your chosen answer on your answer sheet. If you're done answering, what I know activities, later we will check your answer. So now let's proceed to the next activities. Next is what's in. Directions. For you to successfully choose the proper health career that you must pursue, you must always be reminded of the components and steps in making a health career plan. Write them on your answer sheet. You may watch a video from YouTube titled Health Career Planning. So let's watch. After watching the video, let's try to answer the question below. List down the 4 components and steps in making a health career plan. So numbers 1 to 4 give the components and steps given on the video. And number 5, what do you think is your chosen health career? So after watching the video, did you figure out what should be your chosen health career now? So what do you think? Just write your answer and later on we will check. Let's proceed to activity What's New. Directions. Complete the statement below by telling how important it rose and how it became ideal to you. Copy and answer it on your activity sheet. During this time of pandemic, Our health practitioners have played a vital role in saving lives and finding cure for the contagious disease of COVID-19. If you were to be asked, what health career would you choose to fit your qualities and skills? So to answer, my chosen health career is blank. I choose it because, what is your reason? I admire them because blank. So you need to complete the statement below that fitted to your skills and your qualities. Now, let's proceed to our lesson for today. Exploring and deciding on an appropriate health career path. Let's find out on what is it. Health career pathways. What are the different health career pathways? So before we start, let's watch a video from YouTube about the 12 health career pathways. Let's watch. after watching the video about the health career pathways, you now have an idea about the lesson for today. So, let's identify the different health career pathways. Start with number 1, disease prevention and control. People who specialize in this career path focus on communicable and non-communicable diseases. Their work includes immunization, screening of newborns, promotion of breastfeeding, infant diseases prevention, adolescent healthcare, and life skills. Sample careers: community health work, education, and research. Next, number 2, personal health care. Professionals in this field perform healthcare related tasks in a personal care level. These include monitoring patients, administering and assisting in personal care and hygiene, performing housekeeping duties, and advising clients on related healthcare issues like infant care, hygiene, and nutrition. So, main focus of this is about personal care. Next, number 3, maternal and child care. These health workers deal with complex public health issues that affect women, children, and their families. These include providing information on reproductive health, family planning, health care of pregnant women and their children, and improvement of health delivery system through advocacy, education, and research. Sample careers: midwifery community health educator, outreach specialist. Next, number 4, mental health care. These medical professionals specialize dealing with interpersonal and intrapersonal relationships and life skills. These include cognitive and psychosocial development, promotion of health self-esteem through the feelings and anger management, and identifying warning signs or red flags of learning disorders such as ADHD, anxiety, mood disorders, stress, and bullying. Sample careers: social work, clinical psychology, psychiatry, guidance, counseling. Next, number 5, community health care. Specialists in this area focus on the maintenance, protection, and improvement of the health of all community members. Sample careers: barangay or community health work, rural sanitary inspection. Next, number 6, environmental health care management. These health workers try to establish the correlation between and among the physical, chemical, biological, social, and psychosocial factors in the surrounding environment. These include monitoring the quality of environment and impact of human activities on ecosystems and developing strategies for restoring ecosystems. Sample careers: air quality monitoring, soil science analyst, hazardous and solid waste management, environmental noise control, radiological assessment. Next, number 7, drug prevention and control. People whose careers revolve around this area seek to reduce community and individual problems related to alcohol and drug abuse through evidence-based programs and policy advocacy. Sample careers: drug enforcement, drug and alcohol rehabilitation. Next, number 8, nutrition. Specialists in this area find ways to balance individuals' food and nutrition and their impact on patients' health. These include meal planning, food preparation, and economics. Sample careers: clinical dietetics, food and nutrition management, public health nutrition education, and research. Next, number 9, health education. Those who work in this field are tasked with promotion of healthcare and training of health workers on managing change in healthcare. Their work involves assessing individual and community needs, planning, implementing and evaluating health programs, promoting the understanding of various health-related behaviors, plus coordinating health education services. Sample careers: education and research community health work. Next, number 10, dental health. Dental health workers deal with various oral conditions which include chronic mouth and facial pain, oral sores, periodontal or gum disease, tooth decay and tooth loss, other diseases and disorders that affect the oral cavity, and risk factors for oral diseases which include unhealthy diet, tobacco use, harmful alcohol use, and poor oral hygiene. Sample careers: dental hygiene, dental nursing, and dental health support. Next, number 11, occupational safety. Careers in this path are related to the safety, health, and welfare of people engaged in work or employment. These include protecting workers from sickness, disease, and injury arising from possible hazards of their employment and workplace. Sample careers: occupational health and safety, technician health inspector, industrial hygienist. And next, the last one, examples of health career path. Number 12, emergency medical services. People assigned in this work specialize in out of hospital medical care. Their skills include first aid procedures, emergency medical treatment, and transport of patients, rapid emergency medical response, and immediate medical attention. Sample careers: emergency medical aid paramedic. Now, Let's tackle the medical and allied health profession. There are hundreds of allied health professions alongside medical professions that complete the workforce in contributing to patient all-person care, assisting healthcare practitioners and the successful operation of healthcare organizations. Medical and allied health professions. The medical profession is a group of individuals qualified to practice medicine. Allied health professions, on the other hand, are lines of work that still deal with healthcare but are distinct from medicine. Healthcare practitioners with advanced education and clinical training, qualification by certification, registration, and/or licensure are allied health professionals. They collaborate with doctors and other healthcare team members to provide high-quality patient care services to diagnose, prevent, and treat diseases, disabilities, and disorders. Those who receiving training to perform complex procedures are technicians. Under the guidance of technologists or therapists, they are expected to function, and this group includes assistants in physical therapy, technicians in medical labs, radiological technicians, assistants in occupational therapy, assistants in recreational therapy, and technicians in respiratory therapy. Therapists or technologists have more intensive training, which includes acquiring procedural skills. They evaluate patients, diagnose conditions, develop treatment plans, and understand the rationale behind various treatments in order to judge the appropriateness and potential side effects. They also assess patients' responses to therapy and make appropriate decisions about continued treatment or modification of treatment plans. So furthermore, they are licensed to perform the different tasks. Allied health professionals provide services and engage in activities which include: first, prevention. Keep illness or injury from happening. So let me say prevention is better than cure. Next, assessment or evaluation. Appraisal of the condition based on the patient's subjective report. So it is given to assess the patient of what is given to them and to assess the needed of the patients. Next one, identification, diagnosis, analysis based on signs, symptoms, and laboratory findings. And last one is treatment, management and care of a patient or the combating of disease or disorder. Next, rehabilitation or habilitation. This treatment designed to recover from injury, illness, or disease towards a normal condition as possible. Example of this is those who have psychological problem. Next, advocacy. A method by which patients, their families, attorneys, health professionals, and citizens groups can work together to develop programs that ensure the availability of high-quality health care for a community. Next, promotion of health and well-being. The process of enabling people to increase control over their health and its determinants, and thereby improving their health. So giving or promoting health advocacy. Next, education. The process of sharing and gaining knowledge. This was be given to share the knowledge that you acquire about some health issues and to share it to your colleagues. Next one is research. The diligent inquiry of examination of data, reports, and observations in search for facts or principles. Let's proceed with what are the allied health professions that we presently have in the Philippines. Start with number 1, audiologists. So from the word audio, it is identifies and rehabilitates hearing impairments and related disorders. Number 2, chiropractor. Diagnoses and treats neuromuscular disorders with emphasis on treatment through manual adjustments and or manipulation of the spine. Number 3, clinical psychologist. Assesses, diagnoses, treats, and helps prevent mental disorders. So those are the patient that has psychological problems. Next, number 4, dietitian or nutritionist. It promotes good health through proper diet and treatment of diseases. Next, number 5, emergency medical technician, also known as ambulance technician. Responds quickly to any emergency and life-threatening situation to immediately treat serious injuries, physical or mental trauma to increase a patient's chances of survival. So they are given a first aid treatment. Next, number 6, guidance counselor. It is assist students with personal, family, education, and career decisions and concerns. Also helps them develop job finding skills and other life skills needed to prevent and deal with problems. So usually in different school and in different community, we have a guidance counselor. And next is number 7, health educator. It specializes in health education and promotes the development of health knowledge, life skills, and possible attitudes toward the health and well-being of students. Example of this is a health teacher or maybe a health analysis. Next, number 8, massage therapist. Performs the scientific manipulation of the soft tissues of the body for the purpose of normalizing those tissues. Uses manual techniques that include applying fixed or movable pressure on affected parts of the body. Next, number 9, medical assistant. Performs, under the direction of physician, various routine, administrative, and non-technical clinical tasks in hospitals, clinics, and other similar facilities. So medical assistants is the one who help the doctors or the nurses in the hospitals. Next, number 10, medical technologies. Performs a variety of tasks on body fluids, from simple blood tests to more complex tests to uncover abnormalities in the body and underlying causes of illnesses such as HIV or AIDS, diabetes, and cancer, which are not easily detected through physical examination. So example of this, of medical technologies, is from the laboratory clinic. Usually perform in some laboratory clinic with the best medical technologies. Next, number 11 is midwife. Professionals with the expertise and skills in helping women maintain healthy pregnancies, assist in or perform childbirth delivery, and help in women's recovery process through the postpartum period. A midwife is the one who delivered baby, and it comprises with different procedures. Next, number 12 is nurse. Trained to provide care for people who are sick or injured. Monitors patients, health and record symptoms, assist physicians during examinations and treatment, and administers medications. So nurse is the one who help our doctors in some hospitals, assessing the patients and monitor the health and records of the patients. Next, number 13, occupational therapies. Uses purposeful activity and interventions to maximize the independence and health of any client who limited by physical injury or illness, cognitive impairment, psychosocial disinfection or dysfunction, mental illness, or learning disability. Next, number 14, orthotist. Prosthetist, it is makes and fits prosthetics or artificial parts of for the human body. Number 15, paramedic. Gives emergency medical treatment or assists medical professionals in emergency situation. So in some accidents, the paramedic is the one who give an emergency medical treatment or assessing the medical professionals. Next, number 16, pharmacist. Prepares and dispenses medication prescribed by licensed health professionals, also provides information to patients regarding drugs, and consults with healthcare professionals on advances in drugs or medicine. So pharmacists are the one who give us our drugs or the medicine that we are taken, prescribed by our health professionals. Next, number 17, radiologic technologies radiographer. Healthcare professionals who perform imaging procedures such as X-ray examinations, magnetic resonance imaging or MRI, scans and computed tomography or CT scans, and health careers organization. Next, number 18, physical therapies. examines, evaluates, and treats physical impairments through use of special exercise, application of heat or cold, and other physical modalities. Next, number 19, speech-language pathologies. Diagnoses and treats patients with functional and organic speech defects and disorder. So, more on speech problem. Next, number 20, phlebotomies. Professionals with special training in phlebotomy are drawing blood from patients. Next, 21. Radiation therapies. Administers radiation therapy services to patients and observe patients during treatment. Other duties may include tumor localization, patient follow-up, patient education, and record keeping. Number 22. Respiratory therapies. Specializes in the promotion of optimum cardiopulmonary function and health. Regularly deals with various chronic respiratory diseases such as asthma and emphysema. Next, number 23. Social worker. Investigates, treats, and gives aid to people with social problems and help people with mental illness, serious health conditions, financial difficulties, substance abuse problems, domestic or child abuse, unwanted pregnancy, and other social problems. Examples of social worker is the DSWD, or the Department of Social Worker and Development. So there are also allied medical professions whose specialized training is available in other countries. So let's tackle. The number 1 is cardiovascular technologies. Uses imaging technology to help physicians diagnose patients with cardiac or heart and peripheral vascular or our blood vessels ailments. So when we say cardiovascular, it is related to our heart disease. Next, number 2, clinical officer. Performs general medical duties such as the diagnosis and treatment of disease and injury, recommendation and interpretation of medical tests, performance of routine medical and surgical procedures, and referral of patients to other practitioners. Next, number 3, dental hygienist. Specializes in the removal of calcaneous deposit and stains from patients and provides additional services and information on prevention of oral diseases. Next, number 4, diagnostic medical sonographers. Uses ultrasonic imaging devices to produce diagnostic images, scans, videos, or 3D volumes of patients' anatomy. Number 5, kinesiotherapist. Develops and monitors exercise programs to help people regain muscle strength and function loss due to injury or disease. Number 6, neuropsychologist. Specializes in the diagnosis of conditions affecting the nervous system such as neuromuscular diseases, epilepsy, and nerve entrapments. Next, number 7 is medical dosimetries. Design treatment plans for patient by means of computer and or manual computation to determine a treatment field technique that will deliver the prescribed radiation dose while taking into consideration the dose-limiting structures. Number 8. Medical radiation scientist performs complex diagnostic imaging studies on patients and plants and administers radiation treatments. Number 9. Music therapies uses music within a therapeutic relationship to address a client's needs, such as facilitating movement and physical rehabilitation, motivating the client to cope with treatment, providing emotional support, such as an outlet for expressing their feelings through music. Number 10. Nuclear medicine technologies performs imaging procedures using radioactive drugs and materials to make diagnostic evaluations of the anatomic or psychologic conditions of the patient's body and facilitates therapy with the use of unsealed radioactive sources. Number 11 is orthoptics. Investigates, diagnoses, and treats defects of binocular vision and abnormalities related to eye movement. Involves seeing patients of all ages from infants to the elderly. Number 12, pedortists are foot orthotic and orthopedic footwear expert trained in the assessment of lower limb anatomy and muscle and joint function. Number 13, perfusionists assist in performing procedures that involve extracorporeal circulation, such as during open heart surgery or hypothermia. Next, number 14, surgical technologies. A member of the surgical team who serves as a scrub technician or a circulator. Let's proceed with Health Career Orientation Program. A health career orientation is an activity-based career exploration to broaden your knowledge about careers in the health field. Health career orientation helps you to, number 1, evaluate and assess such factors as personal needs, interests, and skills. Number 2, provide an opportunity to identify and explore health careers. Number 3, learn about the duties and responsibilities of health professionals. Number 4, acquire an awareness of a wide variety of educational training and resources for both academic and vocational fields. Number 5, pursue health career pathways for future education or training. We are done on our lesson or what is it to find what are the health career pathways, what are the different health medicals, allied, and also the health career orientation program. So now you can evaluate yourself or and assess yourself for your what is your personal needs, your interest, and what skills do you have to possess and to fit on your health career chosen. So now let's proceed to answer the different activities that given below. Let's proceed to answer the different activities under what's more. Start with independent activity number 1, career day activity. Directions. Think of 2 health careers you like the most. Then select a day when you are going to conduct your interview with professionals that are related or who are knowledgeable about it. The interview may be conducted online through call or text or through messages or messenger. Ask them to share their career experiences or what they know about your chosen health career. So, example is health career number 1, the name of the interviewee, the profession or the work, educational background under what school, college, year graduated, master's degree if they have, school, year graduated, or doctorate, school, and also what year they graduated. Same with health career number 2. Next question. Ask at least 5 questions about your chosen health career. So you may list some 5 questions about your health career chosen. Same with health career number 2. And then, for the experiences, let them share their experiences about your chosen health career. Next, independent assessment number 1. Think deeply. Directions. Answer the following questions below. Write your answer on your answer sheet. Number 1. What health careers do you think are commonly available in your barangay, town, or community? List at least 5 health careers. So, if they have 5, so list them. So, minimum is 3 and maximum of 5 health careers. Number 2. What type of health careers do you think is or are needed in our country, especially during this time of pandemic? And explain why. Next, number 3. In this time of the new normal of pandemic, which health career do you think our government should continually prioritize? Give at least 5. Okay, next. Independent activity number 2. Career posters activity. Directions. Have an in-depth research about a career, identifying the skills, education, and the career path you want to take. Then make a poster and write a short reflection about your work. Be as creative as possible in your design and presentation. You can post your output on your social media account and or group chat on your MAPE class to let others learn more about your dream careers. Next, independent assessment number 2, finding health career. Directions. Find all the words in the list. Words can go in any direction. Words can share letters and can cross over each other. Answer on your activity sheet. So you may copy the activity and then answer the activity. Next, independent activity number 3. Express it. Directions. Compose a song or poem on how health career have contributed to save lives of many people around the world through this time of pandemic. You may write it to honor our frontliners to have served and continuously serving in fighting the COVID-19. So if you compose a song, save it and then send into a group chat, and it is a poem, you may write your answer on the answer sheet. Next, independent assessment number 3. Knowing more. Directions. Answer the following questions below. Write your answer on your answer sheet. Number 1 question is, do you have relatives or someone you know that works in the medical or health careers? Do they work here or overseas? If they work here, answer a question letter A. If overseas, answer question letter B. The question in letter A is, what do you think are the reasons for staying? The reason for staying here. And letter B, why do you think some Filipinos in the field of medical or health professional practice their profession abroad instead in our country? Okay, write your answer on your answer sheet. Number 2, with the growing demand of medical health careers globally, especially during this time of pandemic, what would be its effect to our country? Do you think we have enough health professionals to help us survive this new normal? Write your answer on your answer sheet. Let's proceed with what I have learned. Direction. To assess your understanding, complete the unfinished statement below. Write your answer on your answer sheet. So I have learned that the health careers are blank. And if I am going to take my path to health careers, I would be a blank. Because blank. What is your reason? Now, I would respect and give honor to those who are in the health careers because blank. Okay, let's proceed with what I can do. Directions. Read the article from Inquirer.net. For those who have internet access, you may visit the link. It is provided on your module. And then answer the given question below. And then write your answer on your answer sheet. So, on your module, the article is also provided. So, this is the article from Inquirer.net. Next. Yeah. This is the question from your module. So, number 1 question is, what do you think will be the impact or contribution of this bill to our students who are aspiring to be in this kind of health careers? Write your answer on your answer sheet. And number 2, if you were given the opportunity to be one of the fortunate recipients of this scholarship based on the article, what would you think is the best health career that would be best for you, and why? Let's try to answer the assessment. Directions. Read each statement that describes the different health careers, then write the letter of your chosen answer on your answer sheets. So the assessment has 1 to 15 multiple choices. So you may write the letter of your answer. Letter only. Next, let's proceed to the last part of our module, the additional activities. Activity number 1, collect pictures and create a collage of different health careers that you like the most on a bond paper. Then write a short article on how you admire them and about their sacrifices they have gone through in this time of pandemic. And for the activity number 2, if you have an internet access, you may try to watch videos and participate in a health career orientation program available on the web to help you to gain more knowledge and to be educated about the health careers you are interested. So now we are done on our module number 2 in Health 10, Quarter 4, about exploring and deciding on an appropriate health career path. I hope you gain a knowledge about our health career pathways, on how to decide, and what are the different steps in health career pathways. Also, the Medical Professionals Alliance and the Medical Allied Professions, and also the different programs or health career orientation programs. I hope now you are easy for you to decide what health career pathways did you choose. Thank you so much for participating in our online video lesson for today. I hope you are all fine and okay. Always take care and stay safe. Once again, I am Teacher Jenny, your teacher on MAPE subject. Have a nice day.